Yeah, and then I'll continue. How are you doing?
Wonderful, wonderful.
Oh,
I see I'm live now. Excellent.
okay. How's that, Molly? Are you in?
No, I still can't see it. See how you then start and then it goes to the... Oh, that's it now.
It said there could be about a 10 or 15 second delay.
Yeah, the screen's just changed. It's just black right now, but oh, it's loading now.
Lovely. I think I think you've got a bit of a delay with your broadband still, though.
Yeah, because I can hear you. I can hear you, Karen, but it was what you said about. You said. I can hear myself now. And I think I'm about like 20 seconds behind.
Lovely. So I just need to mute me and then we can hand over to Fraser. Lovely. Thanks, Moll. I'll speak to you later, darling.
Okay.
Bye.
See you later. Bye.
Lovely. That's super. So, Fraser, you've got your slides here. Do you share them or do I need to share them?
I think I'm okay sharing them. It seems like I'm the one who's live at the moment. Is that what you can see on your screen as my slides?
Yeah. No, I can see them at the bottom.
I can see you and the slides, two different boxes.
Okay.
I think it just depends where you click.
Yeah, so if we can get people once they join in to click on the slides screen, and that will hopefully bring it to the kind of the main part of the screen.
That's
can I just pause? I'm going to nip away. I think someone else is on my Wi-Fi, probably streaming Netflix or something. So I'm just going to go and get rid of that now. Yeah. And I'll be back in just a moment.
Yeah, no probs at all.
Thanks.
How you doing, Gillian?
Yeah, I'm all right. How are you?
It's a bit of a baptism of fire.
It is indeed. I know it's.
You've had the chief exec group, and then you've had.
Keeps me on my toes, I suppose. Keeps me out of trouble.
Oh, which is good.
Yeah, it's been busy though. It's just it's been really busy, which is good, I suppose. But it's just such a strange time, isn't it?
I know it really is. My husband's away to work today.
Is he?
They haven't had a meeting. They haven't had instruction.
You know, there's a lot of places. Does he work in construction?
No, he works. He builds buses.
Right. Okay.
No, I'm just wondering. I'm assuming everybody can. I'm assuming everybody possibly can hear us. So
I don't know. This is new to me as well. This. Hold on. I'm just going to let the dog out. Right. I'll shut that gate. How are you? No, it's all right.
There's 10. So Fraser, I think what we'll do is we'll give a couple of people. So far there's 10 attendees, so we know that not 11 now, so I think it'll just rise. I know not everybody can join, and there's a couple of people who've got other virtual meetings happening, so what we might get is a little bit of coming to and fro. But I also, you're going to share the slides anyway, and we're recording this session too, so we're able to share that with colleagues. And so, yeah, I think what we'll probably get is just a little bit of a to and fro with the attendance. So I'm going to mute myself and I'm going to mute Gillian, and then we'll hand over to you.
Sure, absolutely. I'll just crack on. If anybody's got any questions, just let me know. Just unmute yourselves and pop up. So yeah. I hadn't kind of set this up as a presentation as such, but I think I can probably do that. Basically, we are a company called Target Applications Limited. We work with a couple of Scottish housing associations, lots of English housing associations with our product CX Feedback. We've been around for about 10 years, but we've actually, for the moment, kind of suspended all our commercial activities to develop and distribute this, what we're calling the Emergency Community Monitor tool that we've just developed over the last, 5 days, to allow housing associations to better manage the contact with their tenants, both high risk and low risk, during the coronavirus crisis that we're in the middle of. So what it does basically is it checks in with your tenants via email, via SMS, or it gives you the facility to check in via phone call as well. And it basically is super quick to implement. I'll just show you. When I say implement, it's not so much of an implementation as you give us a set of data that we can then manage on your behalf. So what we would need essentially, and the minimum, is the first name, last name, email, mobile number, and tenancy reference of all of your tenants, regardless of whether we have the email or the mobile. What we can do then is create a tenants list within the system. You encrypt the data, send it to us, we upload it to the system and start your questionnaires. So the way the questionnaires work is the first one we send out is a questionnaire that just defines, are you in one of these high-risk vulnerable groups or not? And that defines you within the emergency community monitor system as receiving either a high-risk questionnaire or a low-risk questionnaire. The high-risk ones are sent weekly, so tenants check in their status every single week, letting us know the answers to the various questions that I'll show you in just a minute. And the low-risk ones are checked in with fortnightly, so they let us know the answers to their various questions fortnightly, so we have an up-to-date status on them. Then what we do with the answers is you are given, or the housing associations are given login details, so they can log into the system, view their own tenant lists, manage it all, manage who's falling into which category, manage if people have no food, we can export a list of those people, exactly those people, to then go and help them to acquire food. If people have a complete change in their employment status, is this going to affect their household income? We can then use it to forecast rent arrears a little more accurately, which I think is going to be incredibly important over the next, let's face it, 6 months or so. And it basically allows you to direct your resources where they need to be as a housing association, and then do various other things using that information that are going to help your tenants to get the help they need immediately. I'll say to you now, this PowerPoint is made up of not current product images because we're not finished the development of the UI, the interface of it yet. All of the technology behind it has already existed with us for years now, so it's all very safe, it's all very secure. We're just ordering it into the right place and developing the user interface for it at the moment. We should have phase 1 ready and tested by the end of the day tomorrow, and we should have it up and live and ready to use at the latest by Monday. So we've developed this incredibly quickly, but everything within it, all the GDPR, all the anonymization, all the pseudonymization of personal information is exactly the same as we've been doing with both Scottish and English housing associations for years now. So this is an example of the first questionnaire that goes out. We have it branded to each housing association. We have a welcome page that has text in it that you can customize. You can give information here. You can describe what's going to be happening. And then when they click the next button, they get taken to the first question, which is, do you consider yourself to be in one of the following vulnerable or high risk groups? And this is where they classify themselves. They only get these two screens on the first round, the first week, and then after that they appear, they only get the second, the targeted surveys for high risk or low risk people. So this is the example of the high risk survey. These questions are all set at the moment, but as we get more information from the government, as we have more recommendations and we discover in more detail what the needs of tenants are going to be as we go on, we can adapt and develop these questionnaires, and we can add questions, change questions, and add that all in as statuses for the tenants without altering previous questionnaire statuses. So we start off with what we call the critical indicators, which are food, medicine and income. So do you have enough food and supplies to last you the next couple of weeks? Do you have enough medicine to last you through the isolation period? And has your household income been drastically affected by the coronavirus outbreak? We then move on to what we call the well-being indicators, and these arguably, as time goes on, will become much more important than the critical indicators. It looks like the government's going to step in and start feeding people who can't get out and giving them medicine if they can't get out. So that is going to be catered for by the government, we think, in the next 2 weeks to a month. However, well-being indicators are not going to be catered to by the government. There's going to be advice and help and things, but we're not going to be able to individually ensure that each tenant is getting regular exercises, communicating regularly with other people. So what we want to do is monitor their individual well-being statuses for the 3 dimensions of well-being, which is social well-being, loneliness, regular exercise, and we've said overall, I feel positive given the circumstances. Basically, it's mental health. We're going to probably see quite a drastic decline in people's mental health because of the other factors that are going along with it. That's almost inevitable. We want to be able to identify that up front and just, be able to provide them with information, or actually use one of the things that we're about to talk about, which is the idea of hopefully collating a list of tenant volunteers who are willing to help some of the more vulnerable and high-risk tenants to cope with the well-being side of things, and also hopefully with the critical side of things in the meantime. So we ask each high-risk tenant, would you be open to accepting some help? And then we also give them the opportunity to add a little comment, just tell us how they're doing, how they're feeling, how they're coping. Maybe share some best practice for what they're doing. Do they have a little exercise routine where they're walking up and down their front steps 5 times an hour or something like that? Then we request, can we check in with you in a week's time to send the next week's questionnaire, and then a thank you page where we can again include any links or information or telephone numbers that we want to give them, customize it completely with your logo, your branding, and it will appear as if it's coming from each housing association as it comes out. Then if we take a quick look at the low risk survey, this is for people that haven't identified themselves as being in a vulnerable group. However, they will be, as we know, isolating themselves again, because everybody has to isolate themselves now. So it's things like, are you or a member of your household in self-isolation right now? Again, we wrote that question a week or so ago, so that's now changed. People are in self-isolation, so we might change that to something else. Are there any cases of the virus in your household right now? Has your household income again been drastically affected? Then what we might want to do, and it's something we really want to focus on and recommend, is asking our low risk tenants, do you think that you would be able to volunteer some time or some support or some company to our vulnerable residents? So we can ask them, are they open to helping with telephoning residents, with doing a bit of a food shop for vulnerable residents, picking up medical supplies? Is sharing any best practice for how they're coping. Anything we can do, anything people can volunteer with, is things that our housing associations don't need to do themselves, and they can then focus on doing the things, helping the things that only they can help with. And then again, can we check in with you, and a personalised thank you page. Now, this is what the housing associations will be able to see. This is what they'll get access to. They'll be able to manage their individual tenant lists. They'll be able to monitor the settings, the information text that we're sending out at the start and the end of the questionnaires. We'll be able to monitor the well-being indicators, both as it stands and trending it over time, so we can notice if that's dipping or going up, whatever's happening. And then we can start reviewing things like the critical indicators. We can build lists of the housing association's tenants who, for example, need supplies and medication, or need supplies and medication and have had their income drastically affected. So we can monitor these. They're all heat mapped out. It comes with some standard ones. standard lists. Also, we can create our own lists. We can create custom lists, and then we can export this information out and send it to the relevant teams within the housing association to start putting plans in place, enacting action plans that are going to help them to use this information that they have, this up-to-date tenant information, that they can then use to give help to the tenants that need it. We also can give them access to the ability to check in by phone. So while predominantly we will be contacting the tenants via SMS and email, we have the ability for them to look for the non-responders and then go work through it and check in via phone, or if we want, print the survey out and check in via post. So what they can do is search for the individual tenant, click the link and phone the tenant. And that way the survey pops out as if the tenant was filling it in themselves, and the housing association can fill it in with them on the phone, save it all, and then we can then start using that data alongside the tenant's self-filled data to enact any plans that we might want to put in place. Also, we can manage and monitor the volunteers list, so we can start figuring out who is available to help with things like shopping or a phone call every week. Phase 2 of the system, which should be available the week after next, is going to allow us to actually pair up tenants who are willing to do some communication with tenants who are open to receiving some communication. So we could maybe assign 5 vulnerable tenants to 1 tenant volunteer, and they can phone them once a day or once every couple of days just to check in and give them a phone call, give them somebody to speak to, give them a bit of company. Even if they're not providing anything more than a voice on the end of the phone, that's going to have a massive effect on people's well-being and help them to get through what is going to be a very, very stressful time for them. So that's about as much as I can show you really at this point in time. Some of the benefits that we've identified for housing associations is that, you know, vulnerable tenants are going to need some form of help, and you only have a certain amount of resources that you, as a housing association, that you're going to be able to devote to this. So we can do this, set this up extremely easily and quickly, and then it just runs in the background until you tell it to stop. It gets you all the information you need automatically for each range of tenants, and then will allow you to use that information to enact what you want to enact, and direct your resources to where it's going to be most needed, and then also obviously just show your tenants that you're listening, show your tenants that you care and that you're doing something to help them, and that they have somebody there out there supporting them if they don't have it anywhere else. So that's kind of the end of the presentation. I understand it's not particularly in depth at the moment. I can't show you the product itself, but hopefully that's given you guys an idea of what we would like to be presenting to housing associations and their tenants. I'll take any questions now if you have them. If anybody's speaking, I can't really hear you. Let me see if I can. Karen, I think your microphone's muted on Teams.
Yes.
Hello,
so,
I've got you.
Lovely.
Hi.
So if anybody's got any questions, can they make sure that they unmute themselves, please? And that way then.
I can hear you.
Yeah, that way, Graham, that way Fraser can hear. Gillian, have you got anything that you? Oh, Gillian, can you unmute yourself because we can't hear you? So on your screens, you should have what looks like a little microphone. If you want to speak, can you just click on that?
In the bar that pops up along the middle of the. I can't hear you either, Karen, sorry.
No, sorry, it's just
there you go, you're back.
telling me that no one can speak as it's a live broadcast.
All right, okay.
Does anyone want to
why
ask
don't
questions
we
to Teams?
Yeah, why don't we do the chat? Let me open up the chat.
Yes, please, that would be super.
There we go. So if anybody has any questions, they can type it into the chat, or alternatively, if we wanted to cut it there, we could collate the questions via email, and you could send them through Gillian or Karen.
Yep. Lovely. That's super. So Fraser, are you able to share that presentation with myself and Gillian, and then we can add it onto Teams, and then what we can do is we can collate any questions that come in, then we can send them over to you.
Yeah, that sounds great. That sounds great. Yeah, and if we can talk about next steps after that, what you'll need from us, what we'll need to get you to take out, and how best to take that out, that'd be great.
That's super. Lovely.
Okey-doke. Well, thank you everybody that's here for listening. I hopefully look forward to working with you and helping some tenants out with this.
Lovely. Thank you very much indeed, Graham. Bye.
See you later, guys. Bye-bye.